Hi, my name is Sam Wood. I'm a professor of emergency medicine at the Tufts University School of Medicine, and I work clinically in the emergency department at Maine Medical Center. I'm going to talk about the learning climate. What is the learning climate? It's the context where students learn, the overall atmosphere or culture. Importantly, it is the learner's perception that defines the learning climate. The team leader may think the learning climate is delightful, but the medical student may not. The most important reason that the learning climate matters is that in a positive learning climate, learners learn better. We can look to a couple of concepts to help understand why. Cognitive load theory states that your overall cognitive load is comprised of three parts. Intrinsic load is the inherent difficulty of the material. Extrinsic load is whatever else is going on outside the material that's occupying your attention. And germane load is the work of understanding and organizing new information into long-term memory. This is a zero-sum game. If one of these loads increases, it decreases bandwidth for the others. Imagine a team where learners are pimped aggressively and belittled if they give a wrong answer. The learner's whole focus turns to self-preservation. How do I avoid embarrassment? Extrinsic load explodes as the learner's focus becomes self-protection. Working memory is drained, people can't think creatively or consider questions or doubts, and they can't form or store new schemas. Our learners need to feel a sense of psychological safety to learn effectively. But it's also not a productive learning environment to have no stress or pressure. Everyone would just be asleep. There's a happy medium of stress that maximizes ability to learn. The Yerkes-Dodson law originated from research on mice that had to choose the correct door and received a low, medium, or high shock when they chose wrongly. Mice who received the medium shock learned faster than those who got either low or high. Now, I'm a little skeptical that we can extrapolate from mice choosing one of two doors to how adult physicians in training learn, but I do think that this concept makes intuitive sense. With no stress, the learner is disengaged, and with too much stress, they can't focus. Somewhere in the middle, the learner is activated, attentive, and excited to learn. There are other benefits to a positive learning climate. In simulation studies, teams perform better in a positive learning climate. It helps patients when people feel safe sharing information and raising questions. And if that's not enough to convince you, more positive learning climate is associated with better educator evaluations from learners. The combination of psychological safety and accountability can be represented by this chart. If both psychological safety and accountability are low, the team is in the apathy zone. Low pressure, high safety means there's no motivation to learn or improve. High pressure, low safety, this is an awful place to be, the anxiety zone. Let's look at some ways to ensure high safety, high accountability, and a positive learning climate. First of all, learn names. This is basic, but it's not easy. As someone who works with a new learner every shift, my tip is to write the name and pronunciation down when you first hear it. Really clarify it the first time. This is much easier than asking someone what they go by hours or days later after you've forgotten. Also, try asking your learner a non-medical thing about themselves. This takes 10 seconds, and it makes them feel seen. Acknowledge difficulty. When a learner gives an answer, pick up on where they're correct. Invite and be respectful of thoughts. Demonstrate genuine interest. Use humor. And aim for frequent, low-stakes feedback. Acknowledge uncertainty. This is so freeing and it feels so good. In my opinion, what best enhances the learning climate is when you as the teacher are asked a question that you really feel like you should know, but don't. When you can overcome your ego and bravely say, I don't know, let's find out. That is magic for the learning climate. Avoid incivility. This can be hard when you feel stressed or frustrated, but try to remember that a demeaning or rude comment from you is likely to explode everyone's external cognitive load, and it's going to be really hard to get them back. To increase accountability, demonstrate your own enthusiasm for the topic and for learning in general. Make sure you involve learners in the discussion. Ensure that learners have a meaningful responsibility in patient care. This is what makes learners feel that they're really part of the team. We want learners to have graduated, appropriate responsibility. To summarize, remember that learners learn better in a positive learning environment, and that educators can foster a positive learning climate by techniques that ensure psychological safety and cultivate accountability and responsibility.